In our changing world, there's a real need to access virtual healthcare. And today at Sun Life, we're leading the industry with virtual care innovations. Lumino Health Virtual Care, powered by Dialogue, lets employees and their family members connect with healthcare professionals online and receive a diagnosis and treatment for physical or mental health concerns. Online cognitive behavioral therapy and virtual paramedical services also provide effective treatment from the comfort of home, eliminating travel, reducing wait times, and helping Canadians get back to feeling their best faster. Learn more about Sun Life's virtual healthcare solutions.
And I think a lot of the conversation we've had so far, we're kind of weighing the cost of the benefits versus the, pardon the pun, but the benefit to the employees and making sure that the value there is there. So Patrick, that's one of the questions we want to talk about as well today, is how can you kind of reconcile what a small business owner is looking for in a benefits plan versus what they can afford to pay for their workers?
Well, I think for one of the first thing we have to do is remember that a lot of employees don't know how much insurance costs. Most employers are paying at least 50% of the cost, and it's a little like healthcare in Canada. Unless you go on a trip down south and you break a leg and you have no idea how much it's costing. And it's always surprising to see how expensive it is. It's the same for healthcare. When employees look at what they're paying, they don't realize that often the cost is twice as much as what they're paying. And it's important, I think, for employers to be able to show the employees at least once a year how much they're contributing towards these benefits. And I think that at that time, the employee appreciates it a little better because he realizes that the employer is really putting in money, and it's like having like we said, a salary increase, and even better because the salary increase would be taxable, whereas this is non-taxable. So it's worth a lot of money to the employees, and the employees can appreciate it much better. And it's like with stuff like if Frank was talking about telemedicine, it's a great way to reduce cost for the employee and for the employer. Instead of sitting in a clinic and waiting 4 or 5 hours to be seen, and you have to take a sick day, you can just call in and from your desk at work, and often the problem is solved pretty fast. So it's with that kind of additional options, the employees appreciate it a lot, and it's surprising it's not that expensive, and it's the employees see the value of it, and the employer also, because I would imagine it's going to reduce the absenteeism because employees, instead of staying home, are going to end up going to work more.
Sure. And what's the uptake right now on telemedicine and that kind of virtual healthcare space? Are we seeing a lot of employers opt for that coverage?
I think the insurance companies are pushing it quite a bit. Some are offering it in their plans, building it into their underwriting, because everybody sees it as a very value-added feature. And the employers, the minute the employees get it and they try it, they don't want to lose that anymore. Let's face it, it's so much easier, and it's you look at the way it is in Canada. I'm in Quebec, and if you go to the hospital, you're going to wait 7-8 hours before you get to the triage nurse. Like, it doesn't make sense. So it's the employees are appreciating it a lot, and the insurance companies are really pushing it, and we're starting to see a lot of uptake. And maybe Frank can talk to it. You would have more information than I am.
Yeah, definitely, Patrick, you're absolutely right. We do see an increase, a lot of interest. In fact, it's a standard offering in our what we call our Sun Advantage segment, which is 50, groups of 50 employees or less. So that's an automatic offering that we have. But even on our larger group, we are seeing a lot of uptake. At the beginning, it was a little sort of, I would say, clients were really weighing the additional cost versus all the unknowns happening with COVID. But now, as we're getting sort of back to a certain normalcy, we're really starting to see a lot of interest from our plan sponsors. And to Patrick's point, they're seeing that advantage because they're figure if I could keep my employee healthy and productive, and really minimize the disruption and time for those virtual consultations, then it's really an investment that will pay off. Maybe not immediately, but certainly we'll start seeing those effects on absenteeism and disability management.
Sure. And Dominica, just to follow up on that, and not to put you on the spot here, but when you're looking at a benefit, let's say you're looking at virtual healthcare as an option, do you take into account all of the do you look at the cost of it, or do you also look at the cost of it in terms of, your employees have to take the afternoon off to go to the doctor, or potentially take a full day off to do whatever? Is that factored into your thinking when you're looking at the cost of a program?
Absolutely, it is, and it's something that we have a discussion about at the management level. And when we look at benefits, it's definitely something that I would present as an option to management, so that they have all the options available to them and they can make a decision based on that. But it's definitely a consideration, because time away from work is not a good thing.
No, for sure. And I think too, one of the things, with benefit plans that employees, and Patrick, you kind of touched on this, is that they don't know the cost of things. They don't always value what is on the table for them until they have to use it, right? So what's the best way, or what are some of the good ways that you've seen plan sponsors communicate to their workers about the value of the benefits, so they truly understand that investment?
Well, first of all, we were talking about telemedicine. Often the employees don't see the value of the plan when you're talking about life insurance or disability, unless they become disabled. So it's not as concrete as coverage, okay? Like, it's very abstract. When you get into options like telemedicine, where most people are going to use it, then even though it's not that expensive, I think it's going to make the satisfaction of the employees go up, because they're using the plan. And often people that aren't that sick or aren't taking medication feel gypped to a certain extent, because they say, I'm not taking the plan and I'm paying premiums. So this is one way to make it go up, make satisfaction go up. The other way is, I think it's important to be able to communicate to the employees how much the plan is costing, how much once a year. With the salary increases, we're talking about more HR here. With a salary increase, when you talk about this employee salaries, it's not 50,000, it's 50,000 plus how much I'm paying for your benefits to a certain extent. That's what we try to encourage employers to do, is instead of paying, let's say, for 50% of the benefits, we encourage them to go on a percentage of salary. If you can give them, let's say, 4% of their benefits of their salary towards benefits, it's much easier to do that when you present. You have the yearly meeting to talk about salaries and everything. It's much easier to do, and you get away from that old way of doing it, whereas I'm going to pay 50% of your benefits. If you're married, I'm going to pay more than if you're single. Like, it's an old way of seeing things. Whereas with you base it on the salary, it's an easier presentation.
That's a good point, Patrick. And one thing, Todd, that I would add to that is certainly education and communication. So a lot of employees don't know sort of the information or even the tools that they can access, even within their own benefits plan. So the pandemic certainly has driven a lot of telemedicine. So virtual care, the consultation with physicians, is probably the most prominent one. But a lot of other paramedical service providers do offer virtual care. So you could still see a psychologist and do online therapy. There's even chiropractors and physiotherapists that do online therapies as well. So that's one way that to continue to access their benefit, but perhaps employees don't know that they have access to that information. So education, the opportunity to really present these benefits directly to the plan members, either through webinars or when employers can sponsor sort of virtual sessions like this, education sessions where the insurance carrier can provide that information, or through digital tools that, for example, certain carriers have, where a digital benefits assistant will be able to take the data and claims information and be able to guide employees. For example, if an employee is claimed for a prescription drug and it's a brand name drug, and there is a generic alternative, the system will actually tell them, you submitted your claim, here's your reimbursement. By the way, did you know you could also, claim next time for a generic and probably have less out of pocket. So it's really important to be able to leverage and educate plan members on this information. We do this every day, but employees are maybe not aware of everything that's available.
Great.
To a certain extent, what happens when you're not careful is the plan design starts driving the need of services. If you look at vision care, when you don't have vision care, you change your glasses every 4 or 5 years. But because you have a plan that says you're covered, if you change them every 24 months, all of a sudden everybody's changing their glasses every 24 months. Dental plans with a 6-month recall. I don't know who invented the 6-month recall, but all of a sudden everybody's recommending that you see the dentist twice a year. But it's not necessary for everybody. Some people can go once a year. Other people should maybe going every 3 months. But the plan design is driving it, and I think it's important to try to make the employees aware of that, so they don't get into that. The dentist calling, and I have to go see the dentist for a dental recall, and I go even though I don't feel I need it. So it's a lot about education, I think.